Marfan syndrome is due to defect in, and most commonly students tend to mark collagen, which is not the answer. The other options are fibrillin, elastin and laminin. So please note, in Marfan syndrome there is defect in fibrillin. In fact, it is the fibrillin type 1. There is another fibrillin type 2, which is defective in congenital contractural arachnodactyly. This question has been asked twice. You should know the answer. In fibrillin type 2 defect, we get the congenital contractural arachnodactyly, whereas in Marfan syndrome, fibrillin type 1 is defective. So what is basically happening here? Fibrillin normally inhibits the TGF beta. In other words, it regulates the function of TGF beta and it ensures smooth and proper deposition of the collagen in the extracellular matrix. If fibrillin is not there, then TGF beta activity increases, resulting in abnormal deposition of normal collagen, particularly in those places where TGF beta content is slightly higher, and these include zonules of the lens, the periosteum of long bones, and the large blood vessels. And the presentation or clinical findings in the Marfans corresponds to these three locations. For example, you have dislocation of lens, you have what is known as arachnodactyly, you have a coarctation of aorta because of weakness, so these are the findings in Marfans. You have to remember is the collagen is absolutely normal. What is happening is abnormal deposition of collagen. Abnormal deposition of normal collagen is the characteristic finding in Marfan syndrome due to deficiency of fibrillin type 1. Collagen defect, common conditions where we find the collagen defect: inherited collagen defect. The various disorders where you will see the inherited collagen defect include, first of all, the osteogenesis imperfecta. The most important condition where there is inherited defect in the collagen is the osteogenesis imperfecta. Typically in osteogenesis imperfecta, you will find fragile bones. At birth, you will find blue sclera, and the condition is described as a pseudo battered baby syndrome due to frequent fractures. Just like in an abused baby, we have multiple fractures. So it is also known as the pseudo battered baby syndrome. Then we have the Ehlers-Danlos syndrome, also known as the rubber man syndrome. Basically what happens here is hyperflexibility of joints and hyperextensibility of skin. These are two characteristic findings in the Ehlers-Danlos syndrome: the hyperflexibility of joint and hyperextensibility of the skin. Then we also have what is known as the Alport's syndrome. in Alport syndrome, and there is defect in collagen type 4. Collagen type 4 is defective. The defective gene is called 4A5, which codes for the fifth fibril, of collagen, and this is typically found in the basement membrane. This is a basement membrane component. As a result of this, we find nephritic syndrome, which may be associated with sensorineural hearing loss. It may be associated with the sensorineural hearing loss due to the basement membrane of the inner ear. Then we have the Menkes disease. In Menkes disease, the defect is in the transporter of copper. ATP7A deficiency is there. So copper in extracellular matrix is decreased, resulting in decreased activity of which enzyme? Of lysyl oxidase. We had said the lysyl oxidase, the enzyme which oxidizes the lysine and requires the copper for its activity, which is not working properly in Menkes disease. And last is epidermolysis bullosa. Now there are various types of epidermolysis bullosa. You can have the simplex type or the dystrophic type. Here we are talking about the dystrophic type. Basically what happens here, the collagen type 7 is defective. Collagen type 7 is defective, which is part of anchoring fibrils in the skin, resulting in increased tendency for bullae formation. So these are some disorders where the inherited collagen defect is seen. It is not due to some other condition, but inherited collagen defect.